Hello, Ms. Fogle. I am
Hi.
I am one member of the HPA or Health Professionals Associations Club. The goal of this club is to expose students interested in health-related careers to professionals of those careers through networking. The goal of the project I'm currently taking part in is to actually carry out the task of reaching out to nurses, pharmacists, consultants, etc., and interview them to see what it takes to do what they do and get a feel for the student, get a feel for what the student could be doing in the future.
Mhm.
Is there anything you'd like to comment to that?
No, I think that's great to research that ahead of time. There's so many different avenues that you can go through in the healthcare setting. So that's awesome.
All right.
Mm.
The first question I have is, what motivated you to be a registered nurse?
I have no idea. Ever since I was little, I knew I wanted to do two things. I wanted to be a mom and I wanted to be a nurse. So I don't have anyone in my family that's a nurse or in healthcare. So it was just, I don't know where it came from, honestly.
Hmm. Interesting. Well, our second question is, what was your academic journey and thought process to get to your chosen career?
Um, So I knew in high school I wanted to be a nurse. I actually graduated school early. I graduated when I was 16 and started college that very next month. And I started taking summer classes. So I actually got accepted into the nursing program at Navarro right before I turned 18. So I wasn't even old enough to like pass narcotics or anything. It's kind of interesting. I ride horses and was in an accident and paralyzed from my neck down, care flatted, and did a lot of like rehab and therapy. And when I got done with that, I was like, I don't want to be a nurse anymore. Like I'm tired of being in the hospital, right? Because I got to, be the patient for a while. And then after a few years, had a couple kids and decided I did want to go back and finish it. So I did. Actually, was going through a divorce then, and went back with three kids on my own and finished nursing school. So very rewarding. And since then, I've got to do different types of nursing. Just from the floors to ER, OR. Um, I've been a school nurse. I've got to do this case management now. There's just so many different opportunities out there, but I am also going to UTA to work on my master's. So the goal is to be a family nurse practitioner.
Ah, wow, that's actually very interesting because I'm going to UTA for registered nursing and I want to be a nurse practitioner, and you have to get your master's for that. But
Yep.
one thing, this is a follow-up question to the second
Okay.
one. One thing a lot of people are wondering probably, how did you get the money to go to college at 16?
So I actually got a grant from the state of Texas for graduating school early. So I used that, and then I took out a student loan and used that to like buy my books. Always fill out your FAFSA. Um, and then I was working two full-time jobs as well. So it was a lot of juggling. Um, but when I went back with the kids, when I went to finish nursing school, that was actually, I guess, 2010, and then I graduated in 2012. What I did, the boys and I, we just had like a townhome, and I took out a student loan and I got a government grant as well because I was a single mom with three kids. And so the grant literally paid for my school and my books. And then I basically used the student loan to pay my rent and my utilities and, you know, gas. So where there's a will, there's a way. And I worked every other weekend when my kids would go visit with their dad. I would pick up like odd jobs here or there. So you can do it if you want it bad enough.
That's a good message. If you have the willpower to do it, you can.
Yep.
So the third question is, walk me through a day or week at your job as a registered nurse.
So, I work in two different settings. So, I'll say my passion is actually the ER. I do PRN work at Methodist ER in Richardson. It's right off the tollway. Um, ER has always been my favorite. I'm an adrenaline junkie. I like just getting different things in every day. I don't like for example, I like to OR because you get to see, different things. But at the same time, when you're working with a doc and they book up like, 5 elbows, back to back, I mean, that gets boring in there. And honestly, I'm kind of like ADD. So I like to multitask and keep moving and staying busy. And anyways, I like ER the best. I do like full time. I'll do like 3 12-hour shifts. So it just really depends like on my kid's schedule. Sometimes I'll take off like a day from this job and then I'll do like a Friday, Saturday, Sunday. So I'll do like 3 12s in a row. It's really hard to do. I don't recommend that. I recommend splitting it up. But if I'm working from home for the case management job, it's just Monday through Friday, like, 8 to 5. I have a home office, so I don't get stuck in traffic, which is pretty awesome. When I work in the ER, I have to get up about 4:15, 4:30, get on the road, get report by 6:30. And then if you're lucky, if no one, if EMS doesn't bring in somebody coding like right at 6:30, 6:45, you can actually get off on time. So if I get off on time, I don't usually get back home until about 8:30. So it's, a 12-hour shift, but it's so much more, to that. So it depends. With the home office, like I said, I don't have traffic and whatnot. So I can be in a bad mood if I want to and in my own home. So that's really sweet. But, I'm a people person. So I don't know. I like being in the hospital setting, but this has better mom hours. So since I have 3 boys, this has always gave me more flexibility to, make all their school events and, after school events and baseball and whatnot. So
All right. All right. That's
the
really
balance, you got to find what works best for you.
So these 2 jobs, do you work them like separately or like 1 week the 36-hour and then the next week the 8 to 5?
So the 8 to 5 job is my full-time job. So that's every week. The hospital at the ER, that is just whatever shifts I pick up. So I always go it, based off of my kid's schedule. So I look at like my youngest, like his baseball schedule and then his schedule from when he goes to his dad's house. And then that's how I pick up my shift. So sometimes I might do like 1 shift that week. Other times I might do 2 or, if I feel like killing myself, I'll do 3 in a row. So it just depends.
Okay, well, you cut off for a second, but I think I get what you're saying. So, it says my internet is unstable. So you
Uh-oh.
don't have to pick up all 3 12-hour shifts, is what you're saying. You can do
Nope.
1 per week, 2 per week.
Yeah. It's just
Okay.
however many I want. But, right now, because of COVID, the pay for the hospital nursing is really, really good. So, it's hard to say no when they message you and they're like, hey, someone called in and, we're going to give an extra $20 an hour you know, uh, for today, like if you can come in or, especially if it's a weekend, because then you'll get your weekend pay plus your, if you do nights, you can have a weekend pay, a night shift differential, plus they can give you like an extra $20 bonus an hour for coming in like on short notice, or if it's a holiday, like you can really make some really good money. So
Okay.
yeah.
Well, our fourth question is, what are your main work responsibilities?
It depends. So, here on my regular job, my 8 to 5 job, I'm in management. So I have about 12 nurses and 4 social workers and 2 LVNs that I manage. And what we do is we work for a special population of pediatric kids in the state of Texas that are deemed disabled, like they're on Social Security. Um, they can't function, can't live in their community or outside of a nursing facility. And so we basically go in and I call it break them out of jail. But we do an assessment on them that the state actually developed. And we see if they meet what they call like medical necessity. And if so, we're able to get them on a state waiver so that we can get them at home, get them out of that nursing facility. We'll find them like a private duty nurse and therapy and get all their medical equipment and whatnot to be able to live at home with their family. A lot of these kiddos, their parents can be lawyers, doctors, anesthesiologists, whatever you can think of that makes great money. But they're born with these disabilities, and it may cost them $30,000 a month for medications and therapies and medical equipment and whatnot. And so when I say it puts them on like Medicaid, it's not because they're low income, it's because they're so like medically fragile. So it's very rewarding to be able to, help these families because, having a regular family sometimes can be stressful on parents, but when you have a kid that has disabilities, it's very easy to disrupt that whole family function. So not only do we take care of the kid, but a lot of times we're actually helping take care of the parents and let them have more of a normal life as well. So
Hmm.
in the hospital, it's just in the ER, I'll have 4 rooms. 2 of them are usually trauma rooms. And then I'll have 2 regular rooms. So, I can get anything in from, COVID to, someone coding. The last day I worked up there, we had a patient that was brought in that actually had been down for about 10 minutes before paramedics arrived. But there's a 10-year-old that had been doing CPR on him. So we did everything we could to try to bring them back and, let the kiddo know that, they did a good job and whatnot. So, it's hard. So.
And for context, what you said back there, you said it a couple times, coding. What is that?
Where they're not breathing, their heart's not beating.
Oh, okay. The question number 5, what are some of the soft skills and hard skills needed to be successful in your career?
Oh, time management. Number 1, time management. Yep. I would also say like all those psychology classes, which I'm a science nerd. You can ask Jessica. That's where my kids get it from. I love science, but when you get into psychology and they have all the theories and all that, I'm like, just give me like the hard evidence, right? But when you get into like the whole nursing, like you really do utilize it a lot more than what you think you will when you're in school. You'll pick up a lot on those like nonverbal communication skills and depending on, what area you're in, like in ER, I use a lot of the de-escalation techniques and, you have to remember, well, at least for the setting that I'm in, when people come to see me, it's not because they're feeling good. So, everybody's always grumpy. So you can't, wear your feelings. You can't be sensitive. You always have to have time to kind of de-escalate and to kind of get back to normal because, sometimes it's really hard leaving, especially like the ER where you've had a lot of trauma that day. And it's real easy. You can go home like numb or kind of you become numb to like the outside world. Somebody calls, like, as a nurse, you're going to see, you get like family members that are like, hey, I think I broke my arm, can you, does my arm look broke? And you're like, I don't know, I don't have x-ray vision, and I don't see a bone sticking out and it's not bent or whatever. So, but they're like, oh, but it really hurts. Or your neighbor's calling because your, kid's got another nosebleed or whatever. And, it's hard to not be insensitive to things like that when you've, had just such hard trauma the day before. So, yeah.
So it just
But
takes
time management is going to be number one. That's what's going to get you through nursing school too. Staying organized.
Well, the sixth question is, in what ways is the occupation changing your registered nursing field?
Occupation changing. So, just recently, the biggest change is going to be like pay. When I first took this position, working from home, I thought it was absolutely crazy that I was making more working from home than I was making in the hospital. Once COVID hit, that really changed everything. So it's been hard for me as a manager to actually hire more nurses, because everyone that wanted out of bedside nursing forever and was dying for like this work at home job, they're now wanting to go back in the hospital and pick up like on some of this COVID pay, because it is really good. At the same time, like the facility I work at, they're really starting to crack down now that COVID's kind of settling down. They're really kind of starting to crack down more on like that COVID pay, especially like with overtime. And I think that's going to kind of start leveling out a little bit more. But that would be the biggest, like most recent change, was just that big fluctuation in pay. Because I'll tell you, when I first got out of nursing school and first got hired, I was like, really, this is all we're starting out as, so the pays came a really long way.
All right. That's interesting. One thing to think about, a job that you may be sitting around not thinking you're doing much, you're actually getting a lot of pay than being on your feet and, being active.
Right.
The seventh question is, what are your interests in, and what ways does your job satisfy them?
My interest, I've always been a people person. I've always been like the nurturer, the one that like takes care of everyone. So to me, it's always been very rewarding to help people. But you will see, once you get into this field, you do have to put up some boundaries, or you will get walked all over.
My mom, she's a doctor in Fort
Mhm.
Stewart, you know what that is, and she's always telling me stories about how some of her patients, they've gotten a little rowdy, I'd say.
Oh, definitely. Especially with Google, they'll come in, you got Dr. Google.
Yeah.
Yeah.
Everybody's a doctor with Google.
Yeah.
Number 8, what obstacles have you overcome in trying to create a work-life balance between your career and your personal life?
Oh, that's a good one. Who gave you that question? Did Jessica come up with that one? Did you do that one on your own? Oh, I feel like I'm getting like called out here. So I've been really shitty at that. Sorry, I'm not supposed to cuss on here. But when I first started this job back in, 2016, because it was from home, like I'm always a morning person. I get up early and I work out and whatnot. And I would see like I have time to do things before it's time to take kids to school or whatnot. And so I would come in here and I would start working. And I would quit at 5 and do my mom thing with the boys and stuff around the house. But then, because work is right here, I would catch myself coming back in and working more and working longer. And with this job, it's salary. So I'm only getting paid for 40 hours, right? And I was easily working like 60 hours plus. Kids would go to bed, or, I'd have my laptop on the couch and, whatever. But so that's always been huge for me. I had to really put that in perspective because I started burning out. You have a lot of burnout, in the hospital. I didn't anticipate that I would feel like a burnout here, but I did. Luckily, one of the managers that started with me, we're really good friends, and we're just having like a random conversation, like after work one day, and we were kind of both going through the same thing. And so we kind of gave each other like some support. Like if I got on late and I would see that Brandy was on, I'd call her, "What are you doing?" Or she would call me out. And so it was really good to have like that support system, or know that it was normal that somebody, was doing that too. Right now, because I am working two jobs, it's just kind of finding a good balance, because I have found that, when I'll sign up for, let's say, like 2 shifts or whatever. And then if I get that message and they're like, "Hey, somebody called in, say like it's Thursday, like somebody called in for like Thursday night, do you want to come in? We're giving all this extra money, blah, blah, blah," or whatever. A couple of times I was like, my kids are going to be with their dad that night, so I'll pick it up. And then of course I have to work here Friday. I was like, I'm young, I can do that. And then I'll sleep really good Friday night. And the first few times I did that, I was like a zombie. It was not smart. Or I would just pile up so much extra shifts at the hospital. I wasn't getting stuff done around here. So then I kind of started feeling overwhelmed. And, money's great, but money's not everything. So, I had to learn that you have to take care of yourself in order to take care of other people really well. So I practice a lot of self-care right now. And that's huge. So I always think about it too, like, when you're in nursing school and you're getting to practice, different things like with your clinical rotations and stuff, and whether it's, patient education or whatnot, you can't go in and give a patient, education on smoking cessation when you smell like you just smoked a pack of cigarettes yourself. Or, body hygiene when you look like you haven't brushed your hair, your teeth in 3 weeks. I mean, you have to take care of yourself in order to take care of other people and to have them, really listen.
Mm,
So,
mm. All right. What courses in your educational experience proved to be most valuable in nursing?
anatomy and physiology, hands down, by far.
How would you say biology fared?
Um, Biology is more so like it's really helped like with the nurse practitioner, like, with your higher level, with just your straight associate's degree. I would say hands
Anatomy.
down anatomy and physiology, 1 and 2. And that's just with your prereqs. I mean, obviously when you're in nursing school, those courses are more fitting towards, the role that you're going into. But as far as prerequisites, yeah, anatomy and physiology, hands down. Now, microbiology, I told you I was a nerd, so I loved microbiology, but A&P, that's where it's at. And you're going to build everything off of there. You have to have all of that, it's like your building blocks. You have to have all of that for everything that you do outside of that. So, yeah.
What's microbiology?
Microbiology, I'll tell you what I loved about it. It was, we would get to go in like at Navarro, it's where I did mine at. We would go in and, we got to swab like all of like the bathrooms and the water faucets and things like that, and actually culture everything and grow everything. And so, for a girl, like when you're in nursing school, they're like, you can't have fake nails, and you always have to have your hair pulled back. And, when I, was getting to first go through that, I was like, that's kind of weird, because we want to look cute. And then you take microbiology and you're like, I will never wear fake nails again. That's absolutely disgusting, the things that grow underneath there. And yeah, you're not going to see me with my hair down trying to look cute any day in the hospital. It's not happening. Ask your mom.
So you really learn something even more than just class stuff. You learn like stuff about everything. That's one of the things I like about biology too. Like whenever some of my classmates they ask me, "Oh, how are you liking the class? What's it like to you?" I just say I like to apply things to stuff I see every day. Like if I see a frog or a dog drinking water, I say, "Oh, the tongue system helps in whatever." Like just knowing how things work, I like that.
And that's great because when you're in the medical field, you always have to know the why behind everything, whether it's, the patho or whatever. So starting that early, practicing the why behind everything, that's awesome. That's going to get you far.
Okay. Well, our final question: what advice would you give someone, me, who is considering your profession?
Do it. Don't question yourself. Just do it. Um, don't give yourself like an easy way out, or like when I went through it with the boys. One of my teachers asked me, she was like, "Are you sure you want to do this? We've never had anyone graduate from here as a single mom. We've only accepted 60 people in here, and there's like 300 people that applied. You still have a week to drop or whatever." And the way I looked at it is I didn't have a backup plan. I'm just going to do it. So as long as you go into it and you're not like, "Oh, my mom's a doctor and I can go do something else," or if I don't like this, I can switch majors. Don't do that. Just stay with it, and act like you don't have a backup plan. And when it gets hard, just use that to push you instead of giving you excuses. Use it to push you. I don't want to just pass this stupid test. I want to make the best grade on this test. um, that's something I try to instill in my kids as well. So just don't have a backup plan, just push it through. And then when you get done, there's so many different avenues that you can go to, especially if it's nursing. I can't even tell you how many different opportunities there are from nursing, from being on the floor, being in the hospital, um, you know, doing like case management, like what I do, or the BH side, or yeah, even medical now. I mean, it's like I say medical, it's all medical. That sounds stupid, but like the like dermatology, and you can do injections, and it's absolutely crazy the amount of opportunities that you have. And I finished with just my associates. But every place that I have worked at has always offered to pay for me to continue my education, and I've always taken them up on that. And so you never stop learning. You just don't. Right when get comfortable in something, you're gonna see something new, or something new is gonna come out, like COVID. So you will never be bored. Um, but stay organized, and just don't get excuses. Like, don't be the person that's like, "Oh, this is so hard," or "I can't do this," or don't. Just use it to like fire you up.
Mm. Well, I'm Michael Manis. This was Miss Crystal Fogle, and I don't really know how to end this interview, but this is the end. Miss Guerrero, is there anything you'd like to say?